by other kids. Others with prominent ears where they're sort of in between may wait until they're older to make a decision whether it bothers them. Women are much more comfortable wearing their hair up once their ears have been placed in normal position, particularly if the correct anatomy has been preserved within the ear itself. This teenage girl has prominoritis as well. Her ears are sticking out more from the top than at the bottom. Here we see again that her ears are close back to her head after surgery. By some measure, they may be too close to her head. There's almost no ear showing from the front view, and really there is often a little bit of ear showing from the side would be considered normal. In this individual, the protrusion of the ears is also greater at the top than at the bottom. We also see that the earlobes are prominent. After correction, the ear has more of a straight line appearance in the front profile. The left ear has a little bit of curvature in the center, and this would be a little bit of a telephone type deformity after this correction, but it's certainly a great improvement. In close-up from the side view, before we see how far the ear is coming outward from the head, after correction, we've restored the superior crust of the antihelix. In this close-up view, we can see the way the helix now looks back against the head. We've still retained the crease behind the ear so that hair and glasses can be worn normally. The earlobe was brought closer to the head as well. Once again, we see an individual with very prominent ears. And now they are corrected and closer to their head. As we discussed before, the procedure is virtually painless, and most patients have very little discomfort afterward as well. Here we see another example of an individual with very prominent ears. Afterwards, the ears are still visible from the front, but much less prominent. Some small asymmetry between the two ears is fairly common, as it was before surgery. In this individual, the ears are particularly prominent at the top. We see how correction has brought a beautiful natural result. Before surgery, the ear was curving outward, and there was poor development of the superior crust of the antihelix. After the placement of permanent sutures, the ear looks very natural, even under close inspection. The ear has also been folded back again close to the skull. Here we see an individual with a very long earlobe. It has been corrected from behind the ear, and there is no visible scar. Earlobes get longer with age, just from the pull of gravity. Some people think that their ears grow as you get older. They don't actually grow, simply the skin stretches, as does the skin of the rest of the face. Likewise, your nose doesn't grow as you get older either, just the tip falls down as the supporting ligaments lose their strength. Once again, we see an individual with loss of the superior crust of the antihelix causing their ear to curve outward. After correction, the ear now has a straight line appearance, even though it's visible from the front. Before, the ear was curving forward from the scalp. Afterwards, there is a nice natural superior crust to the antihelix, folding the ear back towards the scalp. Here we see the tops of the ears are showing very prominently. After correction, by creating a superior crust, the ear has now been folded back, and the individual can comfortably wear her hair up. Each ear is a little different, and sometimes the correction may vary from patient to patient. Here we see the ear folded very far forward. Correction should produce a very natural, smooth curve to the upper portion of the ear, so that under close inspection, the ear appears normal. Sometimes there's one particular feature that's a problem. For instance, here we see a great deal of widening of the bowl. The cartilage of skin have been trimmed back, so the ear no longer extends so far backwards. The helix now has a nice smooth curve to it.